Hello and welcome. Today we're diving into the world of oral thrush, also known as Candidiasis, a common fungal infection that affects the mouth. We'll explore what causes it, how it develops, its symptoms, treatment options, and ways to prevent it. So, let's get started. Oral thrush is primarily caused by an overgrowth of the fungus Candida albicans. This fungus is normally present in the mouth, digestive tract, and skin of most healthy individuals without causing any problems. However, certain factors can disrupt the natural balance of microorganisms and allow Candida to multiply excessively. These factors include a weakened immune system due to conditions like HIV, diabetes, or cancer. Medications like corticosteroids and antibiotics can also contribute by suppressing the immune system or altering the normal bacterial flora in the mouth. Other risk factors include dentures, especially if they're not properly cleaned, dry mouth smoking, and certain medical treatments like chemotherapy and radiation therapy. Now, let's delve into the pathophysiology of oral thrush. When Candida albicans proliferates, it adheres to the mucosal surfaces in the mouth. This adhesion is facilitated by specific proteins on the surface of the fungus that bind to receptors on the epithelial cells lining the mouth. As the fungus multiplies, it forms characteristic white or creamy lesions. The inflammation and irritation caused by the fungal overgrowth lead to the symptoms we associate with oral thrush. In severe cases, the infection can spread beyond the mouth to the esophagus or other parts of the body, a condition known as systemic candidiasis. Oral thrush is a fairly common condition, especially in infants, young children, older adults, and people with weakened immune systems. Newborns can acquire it from their mothers during childbirth. Individuals undergoing cancer treatment or those with poorly controlled diabetes are also at a higher risk. While it's generally not considered a serious infection in healthy individuals, it can be a significant concern for those with compromised immunity. Statistics on the exact prevalence vary, but it's estimated that a significant percentage of infants experience oral thrush in their first year of life. The most recognizable symptom of oral thrush is the presence of white or creamy lesions on the tongue, inner cheeks, gums, and sometimes the roof of the mouth. These lesions may resemble cottage cheese and can be slightly raised. Scraping them away can leave behind red, raw, and potentially bleeding areas. Other symptoms include soreness or pain in the mouth, difficulty swallowing especially if the esophagus is involved, a cotton-like feeling in the mouth, and a loss of taste. In some cases, cracks and redness can occur at the corners of the mouth, a condition known as angular cheilitis. Diagnosing oral thrush is typically straightforward. A doctor or dentist can often diagnose it simply by visually examining the mouth and identifying the characteristic lesions. In some cases, a scraping of the lesions may be taken and examined under a microscope to confirm the presence of Candida albicans and rule out other potential causes. If the infection is suspected to have spread to the esophagus or other parts of the body, further tests like an endoscopy or blood cultures may be necessary. While oral thrush doesn't have distinct classifications in the traditional sense, we can differentiate it based on its severity and location. Superficial oral thrush is confined to the mouth, while esophageal candidiasis involves the esophagus. Chronic atrophic candidiasis, often associated with dentures, is a persistent form of the infection that can cause redness and inflammation under the denture. Pseudomembranous candidiasis refers to the classic presentation with the white, curd-like lesions. Understanding these variations helps guide appropriate treatment strategies. Treatment for oral thrush depends on the severity of the infection and the individual's overall health. For mild cases, antifungal mouthwashes or lozenges containing medications like nystatin or clotrimazole are often prescribed. These medications need to be swished around in the mouth for a specific amount of time before being swallowed or spat out. In more severe cases, or if the infection has spread beyond the mouth, oral antifungal medications like fluconazole or etraconazole may be necessary. It's crucial to complete the full course of medication as prescribed by your doctor, even if symptoms improve, to ensure the infection is completely eradicated. Good oral hygiene practices, such as regular brushing and flossing, are also essential for managing and preventing recurrence. Preventing oral thrush involves maintaining good oral hygiene and addressing underlying risk factors. Brush your teeth at least twice a day and floss daily. Rinse your mouth regularly, especially after taking medications that can increase your risk. If you wear dentures, clean them thoroughly every day and remove them at night. If you have diabetes, manage your blood sugar levels effectively. For infants, sterilizing pacifiers and bottle nipples can help prevent infection. If you're taking antibiotics or corticosteroids, talk to your doctor about strategies to minimize the risk of developing oral thrush. The prognosis for oral thrush is generally good, especially with prompt and appropriate treatment. Most people respond well to antifungal medications and experience a complete resolution of symptoms. However, recurrence is possible, particularly in individuals with weakened immune systems. Recent research is focusing on developing new antifungal agents and improving our understanding of the mechanisms that allow Candida albicans to cause infection. Some studies are exploring the potential of probiotics and other natural remedies to help maintain a healthy balance of microorganisms in the mouth and prevent oral thrush. Staying informed about these advancements can help you better manage and prevent this common condition.